Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, 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 ATHLers. Welcome to our weekly show. My name is Abby. I'm your Healthy Living MP, and welcome to our weekly show again. I know it's a busy day, very busy day, important day out there. Thanks for stopping by. Please share the show. Trying to raise money, but if you cannot send me stars to raise money, please share the show. Please share the show. Today's topic, as you can see, is 10 important facts about diabetes. So we're going to get right into the show. But before we start, as always, my disclaimer, I'm a provider, but I'm not your provider. So please do not make any changes to your regimen without checking with your own provider first, okay? So just give me a few minutes here. Please share the show. I'm trying to make sure everybody gets information in a timely fashion. Alrighty, so let me just go in here. Okay. Okay. Alrighty. Okay, let's start. Alrighty, so today we're going to be talking about diabetes, alrighty? And for the purpose of this show, we'll be talking mainly about type 2 diabetes, it's adult onset, and the one that can be preventable or delayed as much as possible. Okay, so we're going to get right into it. Let me get my banners together here. So the first thing I want to do, I'm going to try to make this really not clinical because I'm speaking to a general audience. Okay, and hopefully my internet is working there. If it's not, I'll just record the show. Alrighty, so let me just turn this off for now because I know sometimes that interrupts my internet there. Okay, if anybody you guys can hear me there, please just say I can just type in the comments there. Yes, I can hear you. Because sometimes, like I said, my internet acts up. Okay. Ready? So I'll go in here and go to my first stuff. So what is diabetes? Can somebody just type in the comment section there? Yes, you can hear me. Just waiting for a few seconds while I continue to share the show. And down here. Okay, let me see. Oh, thank you. Okay. Alrighty. Alrighty. Good. Alrighty. And in the meantime, if it goes off, just please let me know. Okay. Okay. So you're saying what is diabetes? Now, diabetes, let me go in here and get some of my pictures too. Alrighty. So diabetes is a disease that, feels you get blood glucose in your body. Let me do a little bit of anatomy first so you guys can know what I'm talking about there, make it a little simpler. Alrighty, I'll open up my banners here and my brand. Okay, so try to make it a little more colorful today. All right, so this is your abdominal organs. You got your liver. So your pancreas is the one that's right below your left, like under your left breast area here. So it's over here, right in this area here. When you're watching this again, you can pause and then look at that diagram a little bit more. So the pancreas, okay, is the part that's the body part that's body organ. You got your kidney, you got your intestines and all that. But your pancreas is the one that's responsible for making beta cells. The beta cells is the one that secretes insulin. So when your body is working right, you're eating okay, you eat your food, it turns into glucose, which is like the fuel that's supposed to get your body together and all that. So when you go in there, you eat the food, it turns into glucose. Your pancreas, the beta cells release the insulin. The insulin is the enzyme. You release it and goes into the body cells and go into all the body organs and let your body work perfectly the way it's supposed to work. You don't know anything about it. Nothing happens. It just goes ahead and works like the way it's supposed to work. Clockwork. You eat, the food turns into glucose. The secretes insulin. Your body secretes the insulin. It goes into your blood cells and goes into your major organs, and it protects your body and it makes your body provides fuels for your body. Okay, but for type 1 diabetes, okay, that's usually when you're diagnosed when you're very young, up until before age 20. Okay. Now you're born again, like I said, the pancreas creates, makes the beta cells and release the insulin and all. But for some reason, the body, I talked about autoimmune diseases before, where it's like your body, your immune system, all right, the one that's supposed to fight. Let's say if you have a cold, if you have a bacteria infection, if you have any kind of infection going on, the brain sends the immune system, go out there, take care of that bacteria, take care of that. We don't need antibody, get rid of that. And you get well better, you get better eventually. But what happens is the body turns against itself. Like the immune system looks at the pancreas, that's part of the body, and just says, I don't know you anymore. So I'm just gonna go ahead and I'm just gonna destroy you. All right. And then over time, it comes on when type 1 diabetes, especially when there's a child and all that. Type 1 diabetes, the kids start being raw, they're sitting there and they're very thirsty and they're very hungry, even though they don't look like they're gaining weight, but they're very hungry. And most of the time they're sleepy most of the time, and they start urinating on themselves. Sometimes they pee into bed, and you're thinking, oh my God, this kid hasn't been peeing into bed all this time. What's going on? And they're just sleepy most of the time. In the morning, you wake them up. You have to wake them up so much. And sometimes, unfortunately, most people find out like when the kids was not waking up, you wake up, go in the morning, and you knock on the door, and the child's like completely cold, and you think they're dead and all that, because it could be like a diabetic coma, and they haven't been diagnosed with diabetes. That's because the glucose that's supposed to be, the insulin is supposed to be getting the glucose to go into your body cells to help the body, it just stops working. So all that glucose just builds up into the body, and the body cannot function. The body starts telling you over a period of time, like a couple of weeks or so, saying, I cannot function. There's all this glucose in my body. It's like you going on the highway, right? And you're on the ramp to go into the highway, but there's a big backlog. And after a while, that starts trickling back. So the body's like, I cannot function with all this glucose. And eventually that starts, coming after your kidneys. First, it start going after your brains, your kidneys, your heart, and all that too. So usually by then they have no more beta cells left, because the immune system just thinks the pancreas is like foreign thing. All right. So it destroys it completely. So the only treatment for type 1 diabetes, the only treatment is insulin. That's why most of the time when the kids growing up and all that, it gets a little hard to deal with it, because that's the only thing. You cannot take any pill. So type 1 diabetes, it's like, called juvenile diabetes, early onset diabetes. So it's the only treatment, because it cannot produce the beta cells in order for you to give you a little bit of, a little bit of insulin. Now, for type 2 diabetes, for the purpose of this conversation, type 2 diabetes is the one where over time, after age 20, 21 or so, already right around that time, but most people get diagnosed like later on, like age 30, 40s and all that, but depending on your family history and so usually around that time is when you're not eating okay, you're not eating right, you're not exercising, and also for genetic reasons and also for environmental reasons. They haven't really pinpointed yet, but most of it is like because of your lifestyle and all that. That's when it's like your that pancreas is still putting the beta cells out. The foods, you eat your food, it turns into glucose, it goes down there. Then over time, something happens, and then the pancreas, like, it's not putting out enough insulin in order for you to take that food to go into the body. It's like you go in there, you knock on the door, give me the insulin, we gotta go. We've been doing this for a while now. What are you doing? And it gives a little bit of insulin, and your body cannot take that. Over time, that's when you start having symptoms, because it happens over time for type 2 diabetes. That's why sometimes most people don't even know they have it. And most people are pre-diabetic also, they don't know they have it until like wait, and you happen to go to the hospital or something happens and they do a blood work and they find that you have other things going on. That's why it's important to go to your doctor like every year, to be getting your blood work done and be doing your blood work and all that, to see what your numbers are, so you don't get something serious, devastating doesn't happen, and you find out that you had diabetes and we're chasing your symptoms. Okay. So 1 in 10 people have type 2 diabetes, and a lot more have pre-diabetic, a lot more pre-diabetic. That's the reason why it's important. Again, go to your doctor, get your test done already. And it's also important to be aware of it especially if you have family members. Okay, so let's get to that. We talked about what is diabetes, so we're going to go in here and go back to my banner. So your symptoms of diabetes. Okay, there's 2 types. I told you 3 types of diabetes, like type 1, type 2. Type 1 is the only insulin, early onset. Type 2 is adult onset and later onset. And in diabetes, gestational diabetes is when you get pregnant. Women get pregnant, and over time, and somebody is prone to having becoming just gestational diabetic. That is only transient, meaning that it dissolves after you have the baby. But sometimes that can also lead to you putting yourself at, being high risk of becoming a diabetic later on. Most people don't, but it's just that usually when we talk about it, we say, so when you were pregnant, did they check your blood sugar? Of course, they'll check your blood sugar, and it will keep a closer eye on you, because chances are more than likely that later on, if you don't, eat right and exercise and do all the right things, you're a higher risk of becoming type 2 diabetic later on in life. Okay. So what are some of the symptoms? I'm talking about type 2 diabetes now. Alrighty. What are some of the symptoms of diabetes? All right. So you start feeling a little more thirsty. That's what we call polydipsia. All right. You're like, oh, wait a second. I just drank and I just feel like I need to drink some more. I need to drink some more. Now, there could be other things going on and all that too, but we're talking about diabetes right now. Okay. You find yourself urinating, polyuria. There's the 3 P's. All right. You find yourself urinating, even though you just left from there. Women, of course, if you urinate more and more and more, you want to make sure men, of course, want to make sure you don't have urinary tract infection. All right. You're really hungry, even though you just ate, you're eating and you're not putting on any weight, because again, you can start off with being like heavy set and have diabetes, but also had a lot of patients. There are a lot of other different populations that are really skinny or not skinny, but like not heavy set. And they also have high risk of diabetes and high population of diabetes in that population because of the kind of food they eat. All right. So you can just say, okay, well, you're skinny and how come you have diabetes? So it doesn't always mean that because you're heavy set, and you have diabetes. Okay. Alrighty. So again, the 3 P's. Your polydipsia here, you're feeling thirsty more than usual, you're feeling you're urinating more, and you're always hungry. Okay, you're losing weight without trying, because if you're like, have you been trying to lose weight too? I was like, you look like, So that can also be going for a type 1 diabetes too, but I'm talking about type 2 now. Already, somebody do your blood work. They find some ketones in there. That's a ketones as a byproduct because your body's not releasing that glucose. So, and that's not supposed to be in your urine. You're feeling tired and weak more than normal. You become very irritable. Like people talk to you and you're like so quick to blow up on them. If you're already like that, maybe you become a little bit more than that. Alrighty, and you have a wound. Let's say you have a wound in your foot or somewhere on your body, and something that's supposed to heal over like a short period of time, and it's still going on. You'd be like, why is this taking so long for me to heal up and all that? For men, you start suffering from erectile dysfunction because again, circulation. Diabetes also. Remember, I did if you missed my show on erectile dysfunction, go back and watch that. Okay, and for some Black people too, you have like a darkened skin on the back of your neck that you can see. Some people have like hyperpigmentation, but it's really dark and it's like velvety feeling. So most of the symptoms you want to look at. So we'll say, okay, so alrighty, that's some of the symptoms. And again, some people have no symptoms. Again, like I said, you can. It'd be incidental fine. You went to the hospital for some other reason, or you went to your doctor's office when they're doing your routine testing or looking at something else and say, maybe there's something else going on there. Let's try to get this one. And that's when they find out that you are diabetic. Okay. So sometimes you don't have any of these symptoms, or you just attribute them to something else. Like, again, like I said, you could be urinating a lot and you say, okay, maybe I have a urinary tract infection, and you go to your doctor's office to treat you for that. But then you have a urinary tract infection again. They'd be like, okay, maybe that's one of the signs to yeast infection and urinary tract infection. All right. So what are the risk factors for diabetes? All right, I'm going to be, if you have any questions, just leave it there. I'll be answering that, okay? They said genetic and also environmental too. So most of the time we go more like environment, the fact that your lifestyle changes. But if you have a family member that had diabetes and all, you have a higher risk of developing it, especially type 2 as you get older, okay? For type 1, you didn't do anything. It's just the body decided that it's just going to not like your pancreas anymore. Alrighty, so it says that cause of most diabetes not known, but most of the time, again, like I said, it's for because the fact that you have that. So let's go to risk factors. Alrighty, race or ethnicity, Black or African American. Again, doesn't say that Caucasian people can get it. It's just at higher risk. Okay, they're also at risk, but these race are higher risk. Okay, Hispanic, American Indian, Asian American, also yeah, and also people are higher risk, Asian American people, Caucasian too, so they're not out of there, right? So most of the time, I remember I had a class, a coworker, where every time we say something, we'd be like, African Americans, you're like, oh, you guys got like everything, right? So, it doesn't matter, it doesn't mean that you're going to get it. And people say, oh, people always say African American and all that, but, depends on the kind of food that you eat. Alrighty. So also genetics, again, like I said, if you have a family member, first degree relative, your mother, father, sibling, and all, that's a higher risk you got to get it. If you're overweight or obese, if you're not exercising, if you have a sedentary lifestyle, you guys saw my video where I'm like starting to go back to the gym and trying to do a little bit more now. Had a sedentary lifestyle. it could be like, okay, you know, yes, I go to work, but what if you do a kind of work that you spend a lot of time sitting down? Okay, or if you drive somewhere, you spend a lot of time sitting down in the car, going to different places and all, you're not moving around as much. The body's okay, so little beta cells that's supposed to be releasing the insulin into your body and all that extra fat kind of blocks them there too. So they can't put out as much insulin that you're going to need to get rid of that glucose and go into your body cells and all that too. So over that, so that extra fat covers that. And also when you have like fat in the belly, my video, if you didn't see on Sunday, if you have some fat in the belly, which is something you can always avoid, because for women, you get to a certain age and all hormonal changes, you're going to get some fat in that area. So you just need to work on that. Some people normally have some fat in the belly too. So if I'm cutting up there, please give me a sign there so I can know that I'm off, because my internet's acting up again. Alrighty, again, like I said, the abdominal growth. When you measure yourself around your waist there, do you see where it's like, okay, you're supposed to be a certain weight, and start looking at it and see that how it's supposed to be. Okay, if you start getting larger and larger, then you know there's something going on. Alrighty, and gestational diabetes, like I said, it puts you at risk for later on in life. Sedentary lifestyle, high cholesterol. I did my show on high cholesterol. Please go back and watch that. As you get older, because like I said, it's a disease that it affects you as you get older. So when you start getting to the 30s and 40s and all that too, because you know, basically as you start getting older, your activity level lessens a little bit, because when you're younger, you're moving around, you go into everywhere. As you start getting older, you're not doing that. You go into work, you're coming home, maybe you go to a party here and there, but you staying home. And especially like for people who like me, who in the wintertime, who don't like to go anywhere, that's when your activity level is down for like 6 months at a time. So you want to continue doing that. So even though it's colder, get up and move around. All right. And also sleeping too, because if you're not getting enough sleep, your body's like building on that cortisol level. The cortisol kind of, that's your fight, flight, and also you want to make sure that that kind of increases in your body. So make sure you're getting enough sleep. For adults, at least 8 hours of sleep a night. Okay. So if anybody's watching, please just click on there. Just let me know if I'm still on. Alrighty. Okay, so we're going to go to diagnosis here. So let's go in here for my banner. Let me go in here. Okay, so just give me 2 seconds here. I'm going to play my commercial and I will be right back, because I need to make sure this is going on. Alrighty. Hi there. Hello. I'm just going to turn this off. Okay. So if this doesn't go through, I'm going to record this and I'm going to put this back up. Okay. So just try to get this done. Alrighty. So we're going to talk about diagnosis. Like I said, most people are like pre-diabetic. They don't even know. That's when your numbers are not in the normal, but they're not high enough to be diagnosed as diabetic. So let me get back to my pictures here. Okay, so if anybody can just comment it, just let me know everything is going right. So this is it. So when you go there, there's 3 different ways we can diagnose you. Okay, so usually it's like the fasting glucose, where we tell you come in the morning for your, if you do blood work at your doctor's office, or they might tell you to go to the lab, to our patient lab somewhere and get your lab work done. And then we'll see what your fasting glucose is in the morning. It's supposed to be like less than 100. Also, we can test your blood sugar while you're right in the office. That we should be the random, but most of the time it's the A1C. Okay, so hemoglobin A1C. So this is where it is. If it's 5 to 6, you're less than 5 or equal to 5.6, you're normal. Most people, sometimes they're running into 5.7 to 6. That's when you're pre-diabetic. Some doctors decide that, okay, we're going to start giving you medication during that time because you have a higher risk of going into the right side. So you see how the numbers, the letters, and the colors start turning into a little bit red and green as you get over there. So you start off in the blue, you start going to the orange, and you get into red there, and then you get into diabetes. When you get to 6.5, that's when you're diabetic. When you're watching the show again, you can just go ahead and pause this and look at that. Okay, so you're pre-diabetic when you're less than or equal to 5.6. You're normal. You're pre-diabetic 5 to 7, 5.7 to 6.4, and you're diabetic when you're 6.5 and greater. Okay, so those numbers, the higher the number, the higher the complications. So it's very important that you go ahead and you keep those numbers where it needs to be. Try to keep it in pre-diabetic or in the normal range. Okay, so that's the way we can diagnose you for that. So based on when we start going to the treatment now, so we can go in here. So this is also where it is. All right, so you see how the numbers, the same numbers I just told you over there, as you start getting higher over here, that's when the higher the number, that means your diabetes is not well controlled, and that's when you start running into complications. All right, most people have diabetes that don't have any complications over time, they're fine, but then eventually you have some complications, but you want to keep it to where the complications are not, and I'm going to get into complications later. Okay, so it's important that you do that. Alrighty, so let me go back to my banners here. So as far as treatment for diabetes, I'm probably moving my things a little different here already. So I did that part where I said this is your range for that. So we'll get into treatment for diabetes. So depending on the treatment, most of the time you will start you on the pill form already. There's I tried, like again, like I said, I try not to get into the medications on here because everybody, your medications will be tailored to what you have depending on your pre-existing condition. What if you came in there and you have something wrong with your kidney, like you have other kidney issues? We can't start you on a medication that's first line. All right, we have to start you on something else. So, and depending on what those numbers are, sometimes if you're diagnosed and those numbers are much higher, then you may have to be started on other medications too. In addition, you may not be started. We usually start you on one. All right. And then we add on, then every 3 months, you have to check your A1C. Again, people say, oh my God, you just want to bring me over here so you can take my money. Nope, that's not the case. We have to check your A1C and try to keep it therapeutic. So based on your A1C every 3 months, if it's fine, usually we just let it go for like a whole year or so, or every 6 months. But we want to do that every 3 months to check on that. Okay. So try to start you over the pills and all that, and then we'll be monitoring you, watching your kidney levels, everything else, because it does affect the kidneys too. All right. So we'll be checking that every 3 months. When the number, your A1C, when you're 6.5, when it's controlled, when you're type 2 diabetic, when it's controlled, that means it's under 7, meaning the medications that we're giving you is working okay. But even if it's like 8 or so, and if it's staying there, that's good. We wanted to stay there or get a little lower. When it starts getting higher in there, that's when we start working. When you get to 9, when your A1C gets to 9, that's when we have to give you the insulin. Okay, now there are other things are there, like you seen Ozempic on the market, that you don't have to go all the way to 9. They can start giving that to you much earlier than you get to that. But usually, like, you start at 9. You want to stay all the way over there, because that's when you start running into complications. And when you start running into complications, then that's when you have to start seeing all these other doctors, because you can start off with just seeing just your primary care doctor. But then as it start getting into where it's like more and start getting more complicated, if you're type 1 diabetic, you will be seeing an endocrinologist also way before you see, along with your primary care doctor. Okay. So when you start running into complications, meaning your A1C starts going up, that's when we really have to start looking at other things. All right. But even without the complications, we want to ward off the complications as much as possible. Alrighty. So let me just see here. Alrighty. A1C, elaborate, please. Oh, the A1C is the one, sorry, there. Auntie LIBERIA said, please elaborate A1C. Let me go back to this here. That's the test that we do to check for your base, like to check to see where your diabetic level, what's to see what the stage of your diabetes is. Okay. Like, again, like I said, we can do the fasting blood sugar. We can do the one we just do it when you come into the office, but the A1C is the one that we do that. So we just go glycosylated hemoglobin. That's the other name for it. So normal, if it's less than over here, when you're watching this again, like I said, you can pause it and look at it. If you're less than or equal to 5.6, you should ask your doc and be like, what's my A1C? Like, less than or equal to 5.6. Oh, okay, that's good. That means I got to keep eating healthy. I want to stay there. That's where I want to be. All right. then you get to, if your numbers is like 5.7 to 6.4, that's when you're pre-diabetic. Doesn't mean you're not, it just means that you're at a higher risk of becoming diabetic now. Okay, that's why we're pre-diabetic. So we want to keep you. Here. So some doctors, most of the time, this, guidelines say that we're supposed to start you on medication. Some patients who might say, okay, those numbers are there right now. You can go home, you can eat right, you can exercise, you can do everything that you need to do, and those numbers might come down. So I don't want to treat you, especially if you're much older too. We don't go right into treating you. All right. But depending on if you have other pre-existing conditions, like you have high cholesterol, you have high blood pressure, and also all of that puts you at a higher risk of becoming diabetic later on. So some doctors, depending on your medical history, pre-existing condition, your family history, they may choose to treat you then. When you get to 6.5, that's when you're diabetic. All right. And anything after that now, that's when we really start controlling everything with medication and all that. And again, like I said, when you get to 9, it's when we have to introduce insulin. But prior to that, there are other things that we could do too. There are other medications we can have combination, but it will be tailored to you, because the fact that, again, like I said, everybody's different. It'll be tailored to your specific needs. All right. Your doctor or your provider will sit there and discuss that with you. All right. So I hope I explained that enough. All right. And if I don't, I always go back and answer questions when the show's over too. Alrighty. So we'll go back in here. So some of the complications that we're going to run into. Alrighty. So, and of course, like again, when the glucose stays long in your body, and over time, if your blood sugar is not controlled right, that's when you start running into complications. So prior to running to complications, it affects all of the major. It affects your little blood vessels, and then it starts affecting the major blood vessels. Okay, so it also can affect your heart, cause heart disease. We did a show on heart disease and all that too. One of the main factors of that is uncontrolled blood sugar or diabetes. Okay, so it does affect that. It puts you at a higher risk of having a heart attack, having a stroke, and all. I did a stroke on a show on stroke. So those are one of the factors that kind of lead you to having a stroke or a heart attack. Okay. Nerve damage, because it goes after the little nerve. That's when you start finding pins and needles and all in your feet, and you be like, my feet are burning all the time. I don't know what's going on there. It's like it just feel like something like pricking it. And also it's important. So that's one thing that's called diabetic neuropathy. All right, you want to bring that to your doctor's attention. That's why it's very important that you look at your feet. If you're diabetic, you look at your feet almost every day. Take a mirror and look at it. Don't just go like that and say, okay, my feet are okay and all that. Look in the mirror, look at all of that. Wash your feet. Don't walk around with no slippers on. Don't walk around barefooted either, because if you get a little cut there, you can't feel it. The circulation over time, diabetes can affect your circulation. That is the reason why it affects the one in the penis also. So, but it affects everything down there. So that's why most people have diabetes. Diabetes is the number one cause of non-traumatic amputation, meaning like you weren't involved in an accident, something that they had to take your leg off. It's just over time, the circulation is you start getting sores and openings there, and then it doesn't heal. And over time, the doctors have to surgeons have to take your toe out, take 2 toes out, and before you know it, they're like going all the way up to your thigh area. So it's important that you watch yourself, you watch your feet, and look at it every day if you have diabetes. All right. Also, nephropathy, that's the kidney damage. So over time, diabetes, when that sugar stays in your body, you remember what I said, that glucose build up and you don't have enough insulin, the sugar stays in your body over time, it goes after your kidneys. Okay, you start having chronic kidney disease, you go from stage 1. Stage 1 is fine, you don't have nothing there. Stage 2, and when you start stage 3, that's when you start saying, warning sign. Stage 3, that's when you're supposed to be seeing the nephrologists, the kidney doctors also. Alrighty, so it's very important that you want to. That's the reason why you have to go back and also be going to your doctor's office, so we can be looking at your BUN as part of your basic metabolic profile. Some of them words in there, I don't want to get too clinical again. So we got to be looking at that, because we'd be like, maybe we have to change some medications around because it's affecting your kidney. But also, if it's not controlled, it does affect your kidneys too. So if you don't know about diabetes, you can come to us, and when you diagnose and your kidneys already halfway destroyed. Alrighty. So again, like I said, that's why your medication may be different. Alrighty. Eye damage. It goes after the little vessels now. Go have your big heart muscles and all that. It start going after your eyes. So diabetes is one of the leading cause of blindness, adult blindness. All right. So you have to be seeing an ophthalmologist. They have to do your blood work. They have to do your eye care every year. And they might say come a little bit more often. Okay. So, and I did the foot damage. So you have to see a podiatrist. All right. I did a show on foot care. already. It goes after your hearing and depression too, because it's a lifestyle change. All right, it's a lifestyle change where you're sitting there, you have to change your life, you have to be giving yourself insulin, you have to be taking new medications and all, so that can also affect that too. So because of that, some people can go into depression. So you may have to see a therapist for a little while. Sometimes you may even have to be put on some medications to kind of help it until you can get used to it. All right, I'm sorry, my birds in the background, I forgot to cover them. And then also you have to so you'll be seeing a kidney doctor already. If you're type 1 or type 2, sometimes if your number, some people are brittle diabetic, regardless of what medication we put you on, it never stabilizes. So we have to go ahead and just and send you to see the endocrinologist. All right, the endocrinologist is a thyroid doctor. I told you guys about the thyroid gland that's right here that covers everything that controls everything in the body. All right, so you can say, what are the ways we can prevent that? All right. So your health team would be your what are the facts already? So your PCP was your primary care provider, your endocrinologist. You want to be seeing your kidney doctor, depending on what your kidney levels are at the time, because they may change some medications around. You want to see the foot doctor, which is the podiatrist, and you might want to follow with a cardiologist too, because chances are more than likely at this time you also have high blood pressure, you also have high cholesterol. So all of that has to be managed too. So that'll be managed along with your primary care provider. Most of these people you only have to see them once a year, not all the time. All right. And then and then you go on from there. So you say, well, what are some of the ways I can prevent it then? So again, type 1 diabetes, you cannot prevent it. It is what it is. Unfortunately, the body just turns against itself, and then it just destroys your pancreas, and there's nothing you can do about that. All right. So type 1 diabetes, type 2 diabetes, one always say eat healthy, more fruits, more vegetables, eat heavy food in the daytime, but the lighter food and then in the evening, because chances are if you eat in the morning, heavy food in the morning, except if you're not going to work where you do a lot of sitting, because then that means you just cancel out everything. Alrighty. So eat your fruits and vegetables, and then move on from there and eat your rice. If you have to eat your rice, your pasta, whatever it is, then eat less and less and less. And if you have to eat later on in the evening, go ahead and eat your little snacks. Okay. Get more physical activity, 30 minutes a day, 3 times a week or more. All right. At least 150 minutes a week. If you can do more, you don't have to go to the gym. You can do a lot of dancing. You can moving around. There's so many different things that you can do now to keep you moving. If you go into work, make sure you can park far away, so you're walking far away from the car. If you're at work and your workway is safe, you can go for a walk during lunchtime if that's possible. If you want to go to the gym, you can go to the gym too. Make sure you're not going to it's almost time for the time of the year again where everybody's going to be saying, I'm going back to the gym. If you're not the person that will be able to go to the gym, don't go to a really expensive gym. Start somewhere slow where you're paying. I do the Planet Fitness again, $10 a month, and you can cancel anytime. So you go ahead and do that, and then go ahead and exercise. If you want to go somewhere more later on, you can do that, because it'd be like, oh my God, this is it. I'm going to do this. I'm going to do that. Now, some people they make big plans and they can do it right away. People like me, I'll lay in the bed and I'm looking for motivation to get up, and I know I need to get up. Okay. So, and have that person who's a buddy, and make sure that person who's your buddy is also stronger than you, because I'm the kind of person who I'd be like, okay, well, let's not go today. So make sure your buddy is stronger enough for you to do it. Okay. If you're overweight, try to lose weight. Again, I don't try to shame anybody into losing weight. You want to get a healthier weight, because as soon as when you lose some weight, even it's 10 to 15%, because especially if you're taking medications or you're taking insulin and all that, and you lose that weight and your numbers start going down, they lessen the amount of insulin that you're taking. And also you may type 2 diabetes is completely reversible, depending on what your A1C was now when you got diagnosed, because some people get diagnosed literally, and their A1C is 14. And it's going to take a long time to get back down to where it needs to be. Okay. Sometimes it's possible, but it's going to take a long time. It's going to take a whole lot out of you. So nobody wants to give you unrealistic stuff, but it's totally, reversible, and it's also preventable too. I know in my opening, when I did the reel, I said it's easily manageable and easily preventable. Sometimes it is. Okay. So you just have to do that. But again, we're adults. We want to eat. We get tired. We have family. We have young children. We have everything else going on, community activities and all. It's not always possible to not want to eat. All right. Or not want to just lay on the couch and not do as much as possible because you're too busy from work. But do the best you can. Okay. And also, again, like I said, when it's time to coping with it already, you can say, okay, what are some of the ways I can cope with it? Because again, it can be devastating and also and depressing too, especially if you have a child that you're dealing with type 1 diabetes. That can really take over the whole family life, because that's when you're diagnosed as a child, the complications come fast. They come much earlier because you've been living with all this glucose and having to do insulin from the time you were younger. So the complications come a little earlier than if you had type 2 diabetes. All right. So commit to it. If you have diabetes, commit to managing it. It's one of the things where like I'm not a big person on taking pills. Okay. But it's like, okay, I have to take certain pills. I know I have to take it. I put it at my bedside and I take it in the morning. Oh, I know when I go in the morning, I brush my teeth, I take my medicine, everything's right there. So I'm not going around and trying to find things over here and there. I have my routine. So I do that and I say, okay, I know I don't want to take it. I know I have to take it. I go ahead and take it. All right. My eye drops, this right there. Wash my face, put my eye drops in. So you make it easy for family members, especially for us who in the family where you can't have somebody eating something healthy and you sitting there eating, a big bowl of rice, a big bowl of this and that. You can make Liberian food healthy. Okay. I'm not saying don't eat your Liberian food. You can make Liberian food healthy. Stay away from the palm oil, or do it maybe once or twice a week if you don't have to. You can put more fish in the food, all right? Less meat, less calcium, all this different stuff. More seafood, less meat. Like I said, more animals from the sea and less from the land. All right. Drink more water. Try to drink more water. Cut back on the soda. Cut back on the sugary drink. All right. If it's your husband and things like that, and start having complications, and where it's like, okay, it may affect his ability to perform. That's something you guys have to sit there and talk about. Women also, you get a lot of urinary tract infection. You get a lot of yeast infection from that too. You have to talk to your doctor about that already. So there's a lot go with it. And especially if you have to do insulin, you have to make sure when you go into family events, Thanksgiving is coming up. You want, how do I do this? Do I give myself the insulin? And I know my family won't be cooking or they won't be ready to eat at a certain time. Go ahead. Take your insulin with you. If somebody's asked something, tell them, okay, yeah, I'm diabetic. And I know we don't want to talk our business because we're so secretive about everything in our culture. Sometimes you just have to let it go and say, yes, I have diabetes. Okay, it's not a curse. It's not something you did wrong, or because you were eating so much, or because you're fat, or because you're too skinny, or because you this and all that. Let them think what they want. The most important thing is you staying healthy. Alrighty, because you want to protect yourself from stroke. You want to protect yourself from blindness. You don't want to lose any of your limbs because you have to live your livelihood and all. All right, you don't want to lose your kidney where you're going to end up on dialysis, and it's very hard to find a kidney, especially in the Black population where people don't do a lot of donor the organs and all. So it's important, and especially if you live in the part of the country where it's not a lot of people there. So that means when they put you in the list, you're going to be on the list for a long time. All right. So imagine going to dialysis. It takes at least 3 to 4 hours a day and at least 3 times a week. That can really have a big effect on you and your family. That changing your life completely around the kind of job that you do. So it's very important that you do that. All right. Try to stay healthy. Again, just keep on. Even if you don't want to get up, especially this time of the year. I'm telling you, Sunday morning, I did not want to get out of bed. I was like, no, it's too cold. I can say it. I can go next week. My husband's like, just get up. I said, okay, if I go, then you have to be there for me to do my video. He goes, oh, so he says, I'll do your video. So that was why I got up. All right. But I'm like really doing my best to like really stay on this and all, because I know I have diabetes in my family. Again, like I said, all of you who are out there, you have at least maybe 3 or 4 people who have had a stroke, who has high cholesterol, who has diabetes, who have high blood pressure, all right, and maybe some kidney disease, because kidneys, again, you don't know you have kidney disease until you do the blood work or until you start becoming symptomatic, because the kidneys don't hurt, so you don't know. So most people don't know they have kidney disease until they do the blood work, and sometimes it's really far gone. So, but those people, at least 5 people with all those diseases, and chances are more than likely 3 of those people are related to you. Okay, or it may be you. So that means you have that genetic material and connected to you. So it's important that you say, okay, yeah, oh, she's trying to scare me because just my mom got this or this one. I'm not trying to scare anybody. If you went to your doctor's office, they always ask you about your family history. So how many people in your family has this? Anybody in your family had a stroke before? Anybody in your family has diabetes? And especially if they're first degree relatives, your mother, your father, your siblings, and all that. Okay, so it's important. Sometimes your grandparents do it. So it's important. It's not, it's not to scare anybody. It's like become aware of it so you know how to take care of yourself better and take care of your family better. All right. So it's just important, you know. And again, if you have to go out there, if you're diabetic, make sure you have the bracelet on that says I'm a diabetic. And so in case if you pass out in the street, people are not thinking that you're just laying there drunk, that it will help you keep your vaccinations up to date. Because again, diabetes, you if you get sick, you get sick, and you get sick at a worse rate, especially with COVID coming around. It's important that you do that. Pay attention to your feet again, control your blood pressure, control your blood pressure, control your blood pressure, control your cholesterol. Okay, eat healthy again, lots of meat and everything, lots of animal from the sea, less from the land. Okay. Take care of your teeth. You want to also be going, because all of that too, diabetes can also affect the teeth. If you smoke, please try quitting. 1-800 quit now. 1-800 QUIT NOW. You can call it. They have all the resources. You can talk to your provider, and they can provide other things. They have the pill form, they have the patch, they have the gum. They have so many resources out there for you to quit. Okay, because again, you have less circulation. You don't want all this nicotine in your body. That's going to make it even harder for you to heal. And if you have to go to surgery, it makes it harder for you to get through anesthesia too, way if you're a heavy smoker. All right. If you drink, try to cut back, try to cut back as much as possible, because there's like no redeeming quality in drinking alcohol, especially if you're drinking at a really heavy low. Okay. So all of that has a lot of sugar, glucose, and all. You're trying to limit the glucose in your body as much as possible, unwanted glucose. All right. And it can be stressful and all, but try to relax. And at the end of the day, it's like, oh my God, you're scaring us and all. But it can be stressful. But even if you don't have diabetes, try to, because you're trying to like prevent it now. So for those of us who work in a high tension job where you're stressed out, even if it's not your job, your family stuff and all. And like I said, like my husband always say, not drop it like it's hot. That's his big thing. So, if you want to sit there and you stress on stuff sometimes. And again, my friend, she's like the one who was on here, my little niece, she's like, 80% of the thing you're going to worry about would never happen. And I'm that person who will worry about the 20%. I'd be like, what about the 20%? No, it may happen. Growing up, like I was the oldest girl in the family. So it's like no childhood right there. You're busy being responsible from day one. So, and I overthink things and all. And so you worry about different things and all, but it's important, find other ways. Watch mindless TV. Don't stress on Liberian politics too much. Today of all days, right? And just take care and just laugh. Find to not laugh. Like some funny things, people post things on Facebook, and sometimes I just read it. I'm like, oh Jesus Christ, that's enough for today. And so I look at that, and I like to hang out with people who make me happy. I try to stay away a lot from people who, things and people that make me sad. There's so much going on in the world to make you sad. You can just pick at anything and just become so depressed. So it's important that you kind of watch your stress level too, because remember I talked about cortisol. Okay. So it's important. Again, just to review there, type 1 diabetes, there's no way you can prevent it. It's just the body decides that I don't like your pancreas anymore. I'm going to destroy the cells that makes the insulin, and it destroys it. And insulin is the only treatment for type 1 diabetes. Okay. And so watch your children, all that. If you see them urinating more frequently, you see them always very thirsty, eating more, sleeping more, difficulty waking up, please bring that to the pediatrician's attention. Please, 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 please. Okay. It could be like life or death, because if that glucose becomes so high in the body and all that, they go to sleep, they could literally die from that. All right. Because again, the brain cannot function with all that glucose, oversupply of glucose, the major organs, none of that can function. Type 2 diabetes, watch your diet. I talked about how to, the numbers to look for to be diagnosed. So when you go get your blood work, go to your doctor tomorrow and say, by the way, I want to do some blood work. I heard Abby talking about my A1C. I want to know my A1C is. Please, can you get it? Can you get it done so I can know what my A1C is again? All right. Like I said, this is your A1C. That's normal. All right. I'm moving the cursor here. This pre-diabetes and diabetes. Okay. So your doctor can, you guys can discuss that. Try to keep your your blood sugar down. These are some of the healthy food. These are symptoms of diabetes. I already talked about that already. And this is, I did this before. Your cholesterol. This is the healthy one, at risk and dangerous. Again, when you're watching this, you can just go ahead and pause it and go ahead and look at that already. And if you're having a stroke, there's information about, if you're having a stroke, this is all the things you're supposed to look at. Be fast. You want to look for anything sudden change in speaking, slurring your speech, your sight, the ability to walk and all that. So check on that already. Let me go back in here. And this is the blood pressure category. Like I said, this is the normal one. You're less than 120 over 80. And when you start getting to 120, 129 over 90, over 80, usually when you get to 140, when you start getting to 130, that's when your doctor may decide that they want to put you on some medication. Again, you have family members. I will go back again and say it. We all have somebody who at least, at least 3 or 4 people who have had a stroke, diabetes, heart attack, and kidney disease, and all. And those people are related to you, so that just puts you at a high risk. That's your genetic material. But even if you don't, also your lifestyle changes. It's important. Your lifestyle changes. Type 2 diabetes is preventable. It's one of the diseases, luckily, that is preventable, and is also reversible. Okay, because somebody could say, "Oh my God, I thought you said you're diabetic before, and your doctor say you're not diabetic anymore." Yeah, you can work your number back down to completely to where you don't need that. And even some people are like, "Okay, yeah, I'm a diabetic, but my doctor said I can just control it now with just my food because my numbers came down so well that I was able to control it without any of that." Okay, so I'm gonna go in here and just check and see. I don't want to keep you guys too long. I know it's crazy night, so. This person says, Norrish, I just watching from Iron Factory Junction, Liberia. Thank you very much for watching from all the way over there. Okay, so I hope I don't see any more questions there. If you have any more questions, please leave it in the comment section. I usually go back and read all my comments and all. If you like this show, please give me a thumbs up. Please like it. Please share it. I hope there was no technical difficulties in between it. If there was, I'll just watch it again and I'll just place, rebroadcast again another time. All right. But thank you all for watching. For those of you who are watching me from Focus in Liberia and other places, thank you. If you haven't joined Abby Tyler's Healthy Living page, please like and follow, because I usually put out some healthy videos during the week. So you don't want to miss that, because it's usually just on there. YouTube, thank you. Also, please share the show. Please share the show. Please share the show. And I've kept you guys much longer than I wanted to. And I know that you guys have to go because there's so much going on. So thank you all for watching. Thank you all for watching. I really appreciate it. For those of you who are watching now, I say thank you. For those who will be watching later, I say thank you as well. Good night. God bless.